Hello, everyone, and welcome to this installation of our BD Live, Black Doctor Live. I'm your moderator, Dr. Ashanti Carter, and I serve as the Chief Academic Liaison to BDO. All right, you guys, do we have a show for you? You know what? We're going to be talking about liver disease, and I have the pleasure of speaking with Dr. Ratanya Carr. She's going to introduce herself and she's going to talk to us all about liver disease and how you can take care of yourself. All right, you guys, let's give her a round of applause, our esteemed panelist, Dr. Carr. Okay, and you guys, I do want to say that this conversation, it's powered by Salix Pharmaceuticals. So thank you to Salix for allowing us the platform to talk about liver disease. All right, Dr. Carr, can you please introduce yourself to our audience?
Absolutely, Dr. Carter. Thank you so much for inviting me to talk with you and your listeners today. I'm very excited to be here. This is one of my favorite things to do is to talk to people about liver health. So I'm Ratanya Carr. I'm a physician. I'm also a hepatologist, which is a liver specialist. I work at the University of Washington in Seattle, and I do a lot of other things like run the division and I do research. But my love clinically is liver disease, and so I'm very excited to talk with all of you here today.
Wow, thank you. Thank you, Dr. Carr, for joining us. So let's get into the conversation. Okay, so Dr. Carr, let's start with the basics. When we say liver disease, what are we really talking about?
Well, first, to orient your viewers, let's make sure we all know where our liver is. So you raise your right hand and just slide it just beneath your rib. That's where your liver is. I love asking this question. Most people are not really sure even where their liver is. So it sits right here underneath your rib on the right side. And I kind of love that people don't even know where it is, because the liver, when it's well, you shouldn't even know it's there. I mean, it does hundreds of jobs for us every day, all day long, while we're awake, while we're sleeping. We really only know sometimes or think about our liver when we're having problems. So that's what I mean by liver disease, when there's an illness that impacts the liver and can cause liver damage. And it takes a lot to really cause serious damage to the liver, such that you start to feel symptoms from it. And so my job as a hepatologist, when people come to me, it's because maybe their primary care physician has found blood tests that are abnormal that suggest liver disease, or maybe people are feeling certain symptoms. And so that's where I come in to help figure things out.
Wow. Thank you for that. So yeah, you gave us a little exercise, raise our right hand, go under the ribs. That's where the liver is. So yes, anatomy 101.
Yes.
So I wanted to ask, that's great. We don't know about our liver until something goes wrong. So you touched on it. And when we think about liver disease, right, some of us think about cirrhosis of the liver. But what are some of the other common types or causes that of liver disease that people should know about?
Well, cirrhosis is just a generic term. It's a term that means nothing more than your liver's sick. It doesn't tell us what caused the damage. So when we say someone has cirrhosis of the liver, it's sickness of the liver that has been going on for typically a very, very long time. And the liver at that point is having trouble doing all of its jobs. And that's when people may start to feel symptoms of liver disease. But before that point, when the liver is first damaged, there may just be some extra fat in the liver. That's a super common condition that we're seeing now. We have a new name for it called MASLD. It's a very long name. Metabolic dysfunction associated steatotic liver disease. It does not matter. It just means that there's extra fat in your liver that over time can lead to inflammation and scarring and eventually cirrhosis and liver cancer. And then there's other things that can cause liver disease. Sometimes people are over consuming alcohol. I think most people know about that as a cause of liver disease. But even at its earliest stages, people may not feel badly from their liver, or their liver may still be handling things pretty well until it reaches that stage of cirrhosis. There are genetic diseases that can cause liver damage that can lead to cirrhosis. There are even certain medications, if we consume too much and they become toxic to our liver, that can cause a lot of liver damage. So there's a lot of things that can cause liver disease. And I say this because one of the challenges of people, for people, both recognizing that they have a condition of the liver and also just getting help for liver disease, is that they feel a lot of stigma because people assume that they have done something purposefully to impact their liver. And there's just such a range of reasons why the liver can become unhealthy. And so I just give you that long list. Cirrhosis doesn't mean a particular reason why you got liver damage. It just means that your liver is severely damaged. And certainly by that point, and hopefully before that point, you're seeing a hepatologist.
That's great. And you touched on something that really pricked my ears, which is the stigma. Why would a person, I mean, because you said, oh, they feel like they've done something on purpose. Like what? What kind of health behavior?
Well, one of my research areas and loves and joys is focusing on a liver condition that is due to overconsumption of alcohol. When people drink too much alcohol, some people can get liver disease from that. And unfortunately, this is probably the one liver condition that has the most stigma attached to it. People assume that, you've done it to yourself, you're meaning to hurt yourself, but really people who get liver disease from alcohol is just like any other disease that we get, high blood pressure, diabetes, right? It's a medical condition, usually because people have a challenge with drinking too much alcohol. We call that alcohol use disorder. It's a medical condition. It's actually a psychiatric diagnosis, and we should treat it as such. But I think in society, we have really stigmatized this population of individuals so much to the point that they don't want to come in for medical care.
Right.
The doctors and other providers who see them don't refer them as early as other people who have liver disease. And when they say they have liver disease, or certainly the term cirrhosis, people have certain ideas about it. So that diagnosis in particular is one that I think about when I say cirrhosis. But that being said, patients also feel stigma from other kinds of liver diseases. And we have in hepatology even changed names of diseases because of that stigma. It's a very real thing. But liver disease is a medical condition, whether it's cirrhosis, whether it's an earlier part of the disease. It's just, like everything else, and we should treat it as such.
I love that. And you know what? It's all about having platforms like this and conversations like this. So that's why I'm so grateful to Salix for allowing us to talk openly about liver disease. So this is amazing. Thank you, Dr. Carr. So the liver, okay, so I'm going back to my time, did a little bit of time in medical school. And when we learned about the liver, right, it does a lot for the body, which includes detoxifying our body, right, like removing the toxins, right? So that's why we would have, if we take medication, and you have to be careful, right? Because one of the side effects, it could, you could mess up your liver. But, I think the liver, it doesn't get its respect, right? The liver, it does so much for our body, yet we don't talk about it as much as we would like our heart or our kidneys. So do you think because of what we discussed earlier, just with the stigma, do you think that's why the liver, it isn't given as much love and respect as our heart or the kidneys?
I think perhaps, I'd say that's definitely playing a role. I think also just the nature of the liver, we don't ever see our liver. We don't feel it until something's wrong. Like our heart, we can feel it beating. We know it's there. Our kidneys, we see the output of the kidneys through our urine. The liver is, I like to call it a very humble organ. It controls so many of the body's functions, and it's happy to do so. It doesn't need any fanfare. So I actually don't mind that it's, people aren't fully aware of their liver. That's the way it's supposed to be. You're not supposed to be thinking about your liver every day. As long as you are a kind of adapting liver healthy habits, you really, most people should never have to think about or worry about their liver.
Okay. So you said something that pricked my ears. You said we shouldn't have to worry about it, but we all know there could be signs and symptoms, right? That our liver is sick.
Yes.
So what are some of the signs and symptoms that we should be aware of that would signal to us, I need to go and see my primary care provider to see if I can get referred to a hepatologist?
Yeah. So because the liver is the only organ that can regenerate, meaning it can repair its own bad parts up to a point. That point at which you get signs and symptoms is pretty far along. So I would rather have a conversation about how do you prevent even getting to the point of getting signs and symptoms from liver disease. And what I recommend to everyone is on your annual checkup, ask your doctor to run blood tests for the liver. It's not something that is routine, believe it or not, even though it's a very easily obtained blood test, just like, your basic metabolic panel or, a glucose screen. It's actually not recommended by primary care physicians as part of their annual screening. And so depending on your practice, you may have to actually ask for it, but it's one of the simplest things to do. And oftentimes, at least in my clinic, one of the earliest signs, if you will, that there's something going on. People, if your liver enzymes are just slightly abnormal, you likely are going to feel that. But that's the first hint typically of something going on, and you need to get some investigations done. Abnormal liver enzymes, it's never normal. So don't go away from your doctor and your doctor's like, oh, it's just a little bit up. When the liver enzymes are up, because the liver is so adaptable and has regeneration capacity, if the liver is telling you by way of your blood tests that something is wrong, something is wrong. Wow. Do not let it stand there. Like, get further investigation, get a hepatology referral if your primary care physician doesn't know where to go from there. So that's where I like to start. If you have certain medical conditions that put you at higher risk of liver disease, for example, if you have diabetes, if you are overweight or obese, if you have high cholesterol, if you have high blood pressure or family history of any of those things, and certainly a family history of liver disease, I recommend to all of my patients as well, get your blood tests. And then I would go a step further and ask for a liver ultrasound as a screen.
Wow, a liver ultrasound. Okay.
Yeah. Everyone with diabetes should have a liver ultrasound and blood tests because there is a liver condition. I mentioned it earlier. It's that MASLD, that condition that causes extra fat in your liver. I like to shorten it to metabolic liver disease for my patients. It's a challenge of metabolism. So your body's metabolism is not quite right, and it can cause extra fat to accumulate in your liver. This is right now the leading cause in our country, next to alcohol, of liver disease, and we're also seeing it in children. So the highest risk patients or population are those who have diabetes and obesity and all the things I told you about. So you should have that conversation with your doctor and say, hey, I think I might be at risk for this. I heard about it on Black Doctor. Can you just check me with blood tests and an ultrasound? And if those two things are okay, then you're good. But if either one is abnormal, I would say you need further investigation.
Right. So we have to advocate for ourselves and be our own CHO,
Yes,
Chief Health
I
Officer.
love it.
Yeah. Okay. I
Yeah.
love that. I love
Yeah.
that. I love the fact that you talked about self-advocacy, and then it isn't really the physical symptoms or, oh, my side hurts or whatever. It's really looking at the numbers and allowing the doctor or the healthcare professional to be the professional and interpret the numbers.
Absolutely. And looking at your results, because sometimes I just have heard this so often, people coming into my clinic by then sometimes with cirrhosis, and I look back, decade before, and they had this abnormal blood test, and they were told by their whoever was taking care of them that, oh, it's nothing to worry about. So make sure you see your results as well, and really persist and ask questions. We no longer at the point where we can ignore abnormal numbers of the liver, because we know exactly now where that can lead.
I actually like that. And I would even challenge and go a step further, because you said that you teach at a health education, right, institution. So we really need to do better at training our and developing the next generation of healthcare professionals to ensure that we're looking at the liver, right, a little
Mhm.
bit more closely.
Yes.
Right.
Yeah,
Okay.
because most of what we see is very preventable. There's a lot that we can treat and reverse. So
Mhm.
that's the other message. The majority of liver disease that we take care of is reversible, because, as I told
Wow.
you, the liver can regenerate. It can
Generate.
it can get better up to a point. So we want to see people before we've reached that that point where we can't get the liver better. But yeah, most things in the liver are indeed reversible. With some,
Mhm.
once we've identified what's harming the liver.
Wow, wow, Dr. Carr, that's quite insightful. So I want to switch gears a little bit and talk a little bit about lifestyle and prevention. So, and you touched on it, right? So many people assume liver disease only affects those who drink heavily, right? Drink alcohol heavily. But we know that's not the full story, as you've shared that. So let's talk about other risk factors. You did touch on obesity and medication, but can you talk to us a little bit more about diet and how that impacts liver health?
Yeah, this is again so common, and not just in our country but worldwide. About
Mhm.
30% of the population now has this MASLD condition, and a lot of it is related to diet. Not all of it. As I mentioned, underlying medical conditions, genetics, environment. So there are a lot of factors, but diet does play a really critical role. So I like to tell my patients, and when I'm teaching students and other trainees about how to teach about nutrition for the liver, it's really very simple. It's amazing that anyone has to come to me for this information, because it's so simple. I say exactly this. The liver needs just three things. It
Okay.
needs plenty of water, because the liver is mostly water. We don't want a dehydrated liver. The liver needs plenty of vegetables. And I'm not saying fruits, because fruits are not vegetables. We need to make sure we know that distinction. The reason why the liver needs plenty of vegetables is because while the liver can make most things on its own without us eating or doing much else, it needs certain kinds of nutrients that it can only get through vegetables, and only vegetables carry those kinds of nutrients. So the liver needs plenty of water, plenty of vegetables, and the liver needs lean quality protein, whatever your choice. So if you have chicken or fish or lean cuts of, beef in moderation, that's okay, as long as it's not, deep fried or unrecognizable. Those are also healthy options for the liver. And if you're a non-meat eater, beans and soy-based products. So the liver needs plenty of water, vegetables, and lean quality protein. That's it. And then the rest of the equation is just avoiding things that can harm the liver. We talked a lot already about alcohol, and very little alcohol can cause significant damage to the liver. So 0 is best. We would say for females, the maximum is 1 drink in a day, but that should not be every day, all day, every week. And in males, maximum 2 drinks in a day. That's as much as your liver can metabolize in the average male. And most people who drink are probably drinking more than that because you just don't know what the liver can handle. So it's not much. And we know that alcohol is also a carcinogen. It causes cancer. So 0 is best. And if you are going to drink, do it, very, very limited moderation and not every day, not every week. The other thing that I say to avoid is high carbohydrate diet, because the liver needs a few carbs, but when we eat carbs in excess, so those come in the form of sugar, our starches, our potatoes, rice, breads, pastas, all the yummy things in the US diet, the liver makes a decision. Everything ultimately that we put in our mouth goes through the liver. And so the liver has to make a decision. It's like, okay, it's too much. What am I going to do with it? Well, it actually turns those excess carbs into fat. And that's how most people get extra fat in the liver, which again, itself can cause severe liver disease and even liver cancer. So it's really simple, but these are hard. People have had their diets, for a long time, from childhood and through adulthood. If it were simple to fix, we wouldn't have challenges of liver disease due to this, or diabetes, obesity, etc. I'm not saying it's easy, but the information is easy. It's really very simple.
Absolutely, absolutely. So I like the 3 things. So water,
good,
and then vegetables.
Yes.
And lean cuts of protein. Okay. I think with the big 3, we can make a pledge for that to keep our liver healthy. Okay. Yeah. I love it. I love it. So, all right. I did touch on this a little bit, but I want to hear a little bit more about how can primary care providers play a stronger role in catching liver issues early and communicate to patients early, especially Dr. Carr, in communities that really may not have access to specialists. So how can they do that?
Well, one thing we've talked about already, just simply extending the liver, the blood tests that you get on an annual basis. It's not more work. The cost is also about the same. So just get in the habit of once a year adding those liver enzymes onto the blood work, and also really paying special attention to patients who have either family history of liver disease or metabolic liver disease or alcohol overconsumption, because those are the major things we're seeing right now. If we focus on those categories, that's not all of your primary, that's a subset. And in those individuals, you may want to do enhanced screening, like definitely if you're diabetes, you want to do the ultrasound. And then for the others with family history, maybe you do want to do an ultrasound just as a secondary check, or people who are drinking, too much alcohol. You want to, get those liver enzymes, and certainly if they're abnormal, get an ultrasound. So these are tests that are all available in the US, in every community where there's healthcare. Ultrasounds are the most available. And most communities are, while they may not have hepatologists, they may have gastroenterologists. So gastroenterologists are also trained in liver disease. In fact, hepatologists become hepatologists through gastroenterology. So using gastroenterologists is an option. Sometimes there are major academic centers nearby. I know that ours has a phone line that's all the time, 24/7 available to anyone in the community. If they have a question, they can call and they'll get a hepatologist, not a fellow, not a resident. They'll get one
Okay.
of us to answer their questions. And I think most academic centers have something like that as well. And sometimes just finding an expert and sending an email. I get emails often from my colleagues, talking about, have a patient with this, what do you think? Because ultimately we're all colleagues and we're here to help one another. So there are ways in resource limited settings. I used to work as a primary care physician. That was my first job. And
Wow.
I worked in a rural area. So I do very much know quite intimately the challenge of getting wraparound care for patients in rural settings. It is not easy to get them specialty care, even when you are the fiercest of advocates. So I understand. I also know that it is, that it's also possible to do with persistence sometimes. So those are
Yeah.
the things I would recommend. And then if, they want to have more education about some of these liver diseases, we have the American Association for the Study of Liver Diseases, ASLD, that has a website. There's the American Liver Foundation that has a website. I co-founded an organization with other Black gastroenterologists, 10 of them throughout the country, where we focus on gastroenterology health and liver health. And we've created some resources on our website, blackandgastro.org, that really focuses on getting patients through their patient encounter, but there's some good information there for everyone. So there are a number of resources nowadays.
And I think that's amazing. And with our patients and communities, just talking about those resources. So you guys, please, Dr. TikTok, Dr. Google, she named some other
Yeah,
organizations.
I didn't mention any of those.
I know, don't go there. She mentioned where you should go. So we don't need to be on Dr. TikTok. We don't need to be on Dr. Google, right? So
That's
go
right.
to reputable,
Reputable,
yes,
reputable.
reputable organizations to get the
Yes,
information so
yes.
that you can make an informed decision about your care. And even going to BDO,
Yes, I was going to say
blackdoctor.org.
blackdoctors.org is like a really rich resource for patients in the community. So lots of great options for good information.
Absolutely, absolutely, as well as Salix, right? So that's amazing. So all right. Talking about the team of you, YOU, looking at our patients. So for people living with chronic liver disease, Dr. Carr, what kind of care team should they have around them? And how important is it that they have the coordination between the specialist and primary care?
So the care team is really critical when someone has
Mhm.
chronic liver disease. That means that you've had liver disease for a fairly long time, and probably if you aren't having symptoms, you're starting to feel some symptoms. And we'll talk about just for a few seconds what some of those symptoms may be by the time someone has chronic liver disease or cirrhosis. They may have fatigue, trouble sleeping, confusion. They may even start to develop swelling in their abdomen, so in your stomach area, sometimes in your legs. They may see some yellowing, discoloration of their eyes, and in darker complected individuals, it's harder to see the yellowing of the skin, but usually family members will notice that there's something different. We have a way to do it in the clinic. We can look under the tongue and see it, but most, you're probably not going
Looking
to
under
do
the
that.
tongue to see it.
Yeah, it changes
So
color
okay,
from below.
oh,
Yeah,
so
so that's a
then
good place to look. Yeah.
okay, so then Dr. Carr, with our friends, our dental friends, they
Oh,
know that too. Do they
yeah.
know?
I bet they do. I wonder if they're really how much they diagnose. That's a good question. But yeah, they should. And then, the eye doctors obviously are trained, but yeah, sometimes there's yellowing, discolor. So these are real symptoms of something,
Right.
your liver being quite sick. And so for the care team, you definitely need a hepatologist at that point. I would say a hepatologist more than a gastroenterologist at that point, if one is available, and your primary care physician or other provider is part of that team. And I would add, if your center has available even a nutritionist, because at that point, then the nutrition guidance needs to be individualized for the person. So having a nutritionist, and if someone has really advanced liver disease, cirrhosis, where we're thinking about maybe replacing the liver, which is called a transplant, they would need other kinds of professionals as well, maybe surgeons and psychiatrists and things who will evaluate them. But at a minimum, I would say your primary care team, your hepatologist, and if you can integrate a nutritionist, that is really critical, because at that point, the liver is working incredibly hard to do those hundreds of jobs I mentioned, right? So detoxification is just one of the jobs, but it does so many other things. And it needs energy to do all of that work. And as I mentioned, the liver doesn't need you to provide it with energy necessarily, because it will grab it from wherever, including from your muscles. So people who have chronic liver disease or cirrhosis in particular will often lose muscle because the liver is getting energy, causing the muscle to break down so it can take that protein to do all the jobs that it needs to do. So having a nutritionist to counterbalance that loss of muscle is super important.
Wow. That makes sense with, because then breaking down the muscle, you could get the fatigue.
Yeah.
Mm-hmm.
Yeah.
Wow. That's really insightful. And so with the care team, making sure that you have your nutritionist, your primary care doctor, and your hepatologist. Wow. And then if you need a transplant, having your surgeon. So what advice would you give to a caretaker, someone who's taking care of someone who has liver disease, where they need home care?
Yeah. So I am always so in awe of caretakers of my patients who have liver disease, because it's a lot to be on top of. Caretakers need to know also the signs and symptoms of liver disease worsening. So some of those things that I mentioned, and some of those signs can be subtle. So we haven't started talking about hepatic encephalopathy, or HE. That's the brain fog.
Yep.
Yeah, that's the brain fog that can happen. And usually it's the caretakers who will notice, something's a little different about my loved one. They're not talking the same, or they're sleeping different, or they did this really bizarre thing. It's nothing really extreme, but it's often subtle in those early stages. So caretakers are really important. They're often the ones who notice that yellow discoloration on their loved ones, because they're looking at them every day, and they're often the ones to say something first and to get them into care. And caretakers are really very critical in coordinating all the things, because when people have liver disease, their concentration may not be what it used to be, and they really need a lot of help. There's a lot of doctors' appointments, tests, studies, etc., that have to be coordinated. So it's a big role. So I'm always in awe of people who have this responsibility, and so grateful for them to be available for their loved ones.
Wow. Thank you. Thank you for that. So with the caregivers, just making sure that they understand liver disease and how it could worsen, and then making sure that their loved one or the person that they're caring for, they're up to date, and they're really diligent in getting them to their doctor's appointment. So I think that's great. So we talked about overt. You touched on it, and I said, "Oh, it's coming. It was coming." So overt hepatic encephalopathy, right? So sometimes liver disease, it can lead to overt HE, and it can affect the brain. So can you explain what it is in simple terms and talk about the progression of overt HE?
Yeah. So, no surprise in medicine, we like a bunch of fancy words. I don't know why we do this because it is a really simple concept. Overt just means obvious. It means it's obvious. You can tell that something is there. Um, in HE, which is hepatic encephalopathy, we either have overt, meaning it's obvious that someone has this going on, or minimal, meaning I don't know if you have symptoms or not, or maybe something is really subtle. We may or may not know it's there. So there's a range, and we grade. We score, if you will, HE, so hepatic encephalopathy. Hepatic is just liver. Encephalopathy is confusion. So liver confusion as a result of liver disease is what it is. And we grade it on a scale of 1 to 4. So 1 would be that very subtle, mild. You may not, even as a doctor, know what's going on. And then 4 is, all the way to coma. So we certainly want to intervene before that point. And this is something that can happen in liver disease because one of the jobs of the liver, one of the jobs is to clear the toxins of the body. And it clears lots of kinds of toxins all day long. But when the liver is quite damaged and it can't do all of its jobs, those toxins can build up. One of the toxins is called ammonia. So we get most of our ammonia through breaking down foods that we eat, and that food goes into our gut, and the bacteria that are always there in everyone's gut really enjoy those meals and produce a lot of ammonia as a result of them digesting the food that we've eaten, if that makes sense. And when the liver is normal, it can process all of that extra ammonia and get it out of the blood stream. And ultimately, we urinate it out. So it goes through our kidneys and it leaves our body. But when the liver is quite sick with cirrhosis, it can't do that. And those toxins can build up. We produce about anywhere from 2 to about 4 or 6 grams of ammonia a day, and normally. When ammonia builds up and it doesn't leave our body, it goes into our blood and even to our brain. And that's where the confusion happens. And it can cause the brain to not signal well, like the cells in the brain stop communicating well with one another. The brain cells themselves can also even get swollen. And that's a very serious stage of disease. So this is what we mean when we say HE, and what you would observe as a caretaker or provider taking care of a patient is that at the earliest stages, maybe someone's saying, I'm not quite sleeping right. I'm awake at night and I'm sleeping in the day. Something is going on. Usually that's one of the very first telltale signs. Or you might notice that they are getting a little confused, maybe forgetting things, nothing too dramatic, or maybe their mood is shifting and you don't have a good reason why. So any of these symptoms, there's a lot of reasons that these things can happen to anyone. But if you have liver disease, there's a high likelihood it could be from liver disease. So if you're having those symptoms, or you notice your loved one having those symptoms, or if you're taking care of someone, really do think first, could this be the liver? Because most likely it is caused by the liver disease. And just ask that question when you go into if you're listening here and you go into the doctor's office and you're having these symptoms and you have liver disease. Just say, hey, I'm feeling this. You think this is from my liver? Because that prompts them to really think about that as a possibility, even if they're not necessarily thinking about that at the time that you arrive.
That's great. That's great. So I wanted to, because we're almost out of time. Didn't this time go by fast?
It really did. Yeah.
And I told you it was just a regular conversation where we're talking about the liver. As you said, it's a very humble organ, right?
Yes.
Very humble organ.
Very humble.
And who would have thought talking about the liver, it would be so exciting and so insightful, right?
That's right.
The liver is giving us life. So with that, just to close out, Dr. Carr. Okay, so what message, we've talked about this, the liver, all of that, liver disease, a little bit on overt HE. What message would you want our viewers to take away about paying attention to liver health?
Well, most of the time you don't know that there's anything wrong with your liver, so you have to be proactive in looking at your liver health. That's the first message. So ask for those blood tests. I like to ask for them once a year. I don't walk out of any doctor's office myself without that blood test. I don't let any of my family members walk out. No, granted, I'm a liver doctor, so there's that bias, but that's the first thing. The second thing is to adopt a liver healthy diet. I know it's easier said than done, but 3 things: plenty of water, plenty of vegetables. Vegetables are not fruits, and lean protein, and avoiding things that harm the liver, especially alcohol in excess, and also high carbs. So the equation is really pretty straightforward. And the third thing I would say is know the signs and symptoms of liver disease that we talked about when your liver has progressed to a point. It's very important to be under the care of a hepatologist, in my view. And confusion, fluid in your abdomen, yellow skin discoloration. Sometimes people even vomit blood. I mean, there's a lot of things that can happen at that point, and caretakers need to be very involved. And know that most of what we see for liver disease is reversible and or manageable. We talked about overt HE with using lactulose and rifaximin. Pretty simple medications, and we can reduce hospitalizations. We can reduce your likelihood of dying from liver disease if you're on those medications. If your liver disease is from a virus, we have cures for some, for one of them now, hepatitis C. So there are a lot of things that we can do for liver disease now that we weren't able to do before.
Wow, and that's really exciting. Just looking at how with this space, right? And just looking at healthcare, there are things that are preventable and treatable, right? And I really like what you said about the food, because we're at BDO, we're embarking on this food as medicine, and then we're coming together for the holidays. So making sure that even with our meals, it takes care of our liver and it's good for our liver, with water, having our veggies around the table as we're celebrating, and then a nice lean protein. So I think that's amazing, Dr. Carr. So now we know we're going to talk about this. So how can we encourage more people, especially those in communities of color? And I know it's challenging, but how can we encourage them to ask their doctors the right questions about their liver health, right? Because you said some doctors, they're not even trained. So how can we work together to make sure that the doctor is truly team us or team me?
Yeah. So this is such an important question, and I know we don't have a lot of time. One of the things that so your org has been working on, and then our org, the Association of Black Gastroenterologists and Hepatologists, where we only focus on digestive health diseases. One of the things we've worked on is a toolkit for patients. And if you go to our website, blackandgastro.org, we have there a brief questionnaire. And if you fill that out, at the end of it, you will have a printout of what you can take in to your doctor's office, and will guide you through that visit. So you don't have to memorize, what all the things that I mentioned today. And it was designed with you in mind, with us in mind.
Right.
We know that we are often discounted, right? When we say things that we know are happening, we have really quite high burden of liver disease and many other diseases. We even dress differently when we go to the hospital or doctor's office, thinking it's be seen, right? So our whole campaign is on this. The doctor will see you now, and we developed specific tools for just this. So we want you to just print it out, take it to your doctor's office, and be ready with the questions to fully advocate for yourself.
And say the name of the website one more time, Dr. Carr.
It's Black in Gastro, GASTRO.org.
All right. This has been a great conversation. And Dr. Carr, I just want to thank you for joining me and talking about liver health. And of course, this conversation was powered by Salix Pharmaceuticals. So thank you, Salix, for just allowing us to speak openly about liver health and how we can continue to be healthier. So thank you once again. And my name is Dr. Ashanti Carter, and I serve as the Chief Academic Liaison to BlackDoctor.org. And I'm wishing you health and wellness. Bye.
Bye. Thank you so much.